Okay, now we go to the next test here for your chemical examination. We have here the test for your proteins. Okay, so the presence of the protein diurine would be considered here to be the most indicative of your renal problem or renal failure. Because remember, as what we have discussed in our first topic with the renal function, so your protein is not being filtered by our glomerulus. So therefore, expect na dapat walang protein na makikita sa urine. So if you have identified the presence of the protein the urine using your chemical test spot here or reagent strip, so it might signify here problem with the glomerulus or your kidney problem. Okay, so the normal values of the protein here present in the urine. So there are some concentration of protein here that might eventually be able to be excreted in our renal tubules. So those are the proteins which are very small, so therefore able then to pass through our glomerulus during the filtration process. So normal values of your protein here should approximately less than 10 mg per dl or less than 100 grams per day lang dapat. And those protein here which are very small are those only the one could be found here in our urine. Those are including the following here. We have your albumin, your microglobulin, their Tams horseful protein, and you could also find here some proteins that might be added in the urine sample as try to pass through the lower genitourinary tract like pag duman ang urine natin sa ating ureter, urethra, so pwede siyang mag-add ng mga substance na present on that area. It might also be present in your urine pag lumabas na siya. But those substances na mag-add dito sa ating urine sample here, especially in the lower genitourinary tract, do not indicate here an actual kidney damage. Kasi hindi naman siya doon galing sa kidney natin or hindi naman siya lumusot doon, di ba? But rather, nag-add lang siya pagdaan sa mga ere like ureter, bladder, urethra, like anong mga substance or anong mga protein-like substance na mag-add doon. So, we have that one. So you could have here your vaginal secretion, you could also have your prostatic secretion, your seminal fluid, or even the bacteria in WBC. That would be added here for RBC in the case of your menstruation then. And that would eventually be part of your total protein concentration, but it would not indicate here an actual kidney damage. Okay, so we consider here someone to have here a kidney damage if the protein concentration here, you call this one your proteinuria, that's already abnormal protein excretion found in the urine sample here. If that concentration of that is more than 30 mg per dl or more than 300 grams per day, that's already beyond this normal na 10 lang mg per dl or less than 100 grams per day lang dapat. Okay, so remember here that we could also have your positive test result here for the protein in your urine and might indicate here other sources of the protein. So, ang after lang natin dito ay dapat ang protein na coming from the renal na origin. So, we classify here your proteinuria as pre-renal, renal, and we have here your post-renal. Pag pre-renal, okay, the problem with that is the protein concentration is galing siya sa blood natin. Okay, and this one do not actually indicate an actual kidney problem. Renal naman, so nagkaroon ka ng renal proteinuria, that might be defects related to your glomerulus na sa renal tubules. So ito ang medyo concern natin because it would actually indicate here an actual kidney damage. Post-renal proteinuria na on the other hand, this one is this one includes here all the substances that might eventually added in your urine, and those are found here on the lower genitourinary tract. And this one do not indicate an actual kidney damage. So pinaka-after lang natin would be your renal proteinuria because again as one indicates here problem with your glomerulus and your renal tubules or your tubules. So for the classification of your proteinuria, first we have here your pre-renal. The pre-renal proteinuria is characterized here by increased protein, found in our blood, which are protein by nature. So this includes here the presence of your myoglobinuria, hemoglobinuria, or the presence of your acute phase reactants, which are usually present here during your infection or inflammatory reactions. Another one would be the presence of your Benz-Jones protein. Benz-Jones protein here are found associated with the condition multiple myeloma. Multiple myeloma is abnormal production of your plasma protein which try to produce here abnormal immunoglobulin or antibody. And usually what it produces here would be the light chain lang ng ating immunoglobulin because normally ang ating immunoglobulin you have your heavy and light chain. Sa kanya, light chain lang ang pinoproduce na and we consider that one as abnormal na immunoglobulin. And that produces here the so-called here na Benz-Jones protein. Identification of your Benz-Jones protein could be done here by heating your urine sample. And Benz-Jones protein would have a very unique solubility characteristics. So we have that. If you try to heat your Benz-Jones protein at 40 to 60 degrees Celsius, magpe-precipitate ang ating Benz-Jones protein. The same through with the normal na protein. However, here, for the Benzo's protein, if you try to increase the temperature at 100 degrees Celsius, okay, sobrang init na. Di ba by nature, if you try to heat your protein, dapat nag-precipitate ang ating protein. But notice here, pag tinaasan mo ang temperature to 100, ang nangyayari kay Benzo's ay nadi-dissolve siya. Unlike in the normal, mga other protein here, pag tinaasan natin yung temperature, mas lalo sila dapat nag-precipitate. And therefore, this one would have here, identifying this one as having your unique solubility characteristics as compared with the other proteins. Again, pag normal proteins or other proteins, pareho sila dito mag-precipitate ni Benz-Jones. Pero pagdating ng 100, other protein mag-precipitate pa din sila. Because of course, you are subjecting that one to high temperature. Pero notice here that sa Benz-Jones protein natin, pagdating ng 100, kahit sobrang init na, hindi siya nag-dissolve, nag-precipitate further, but rather nag-redissolve siya. Naging clear ang ating solution. Okay, all of this one signify here the pre-renal proteinuria, and this one do not indicate an actual kidney problem. The next one, we have here the renal proteinuria. So we classify this one as problem in your kidney itself. So it might be problem to your glomerulus, which is the site of your filtration. And we have also here problem with your tubules. That's your responsible for the reabsorption. Okay, then we have here, the first one, we have the glomerular proteinuria. Okay, glomerular proteinuria is caused here by the damage in your filtration. Because remember that dapat walang lumalabas sa ating ultrafiltrate all the substances na mga protein by nature. Because again, our glomerulus will not allow the filtration of your proteins. Okay, so nagkakaroon ka ng protein related to your glomerular damage if there will be problem in your filtration process. Example of this problem, we have your presence of the toxins. Okay, amyloid is a toxic substance din. Kung saan ito nagdi-deposit ng substance nito na ito, it will cause damage here. So kung doon siya nag-deposit sa kidney natin, madadamage ang ating kidney. Another one, we have also here your immune complex. Okay, related to your immune complex disorders, like for example, in your systemic lupus erythematosus. Okay, the immune complex try to damage our kidney by complement mediated. Ang complement ang sisira ng ating kidney. The second one, you have your glomerular proteinuria because of the increased pressure in your glomerulus, because of the increased pressure here coming from your heart na pinapump niya. And that's try to cause damage to your glomerulus and therefore affecting the filtration of your proteins. So example of this one condition, we have your dehydration, strenuous exercise, and we have your hypertension, sobrang taas ng blood pressure ni patient. And nagda-damage ang ating kidney, including the glomerular filtration. So, we have your preeclampsia, so this is also hypertension sa mga pregnant na patient. And again, these are your glomerular proteinuria. Another type of your tubular proteinuria, we have here another type of your renal proteinuria would be damage to your renal tubules. You call that one your renal, you call that one as your tubular proteinuria. Remember that your renal tubules are the one responsible here for the reabsorption. So, pag may damage ang ating renal tubules, hindi siya makapag-reabsorb and therefore, lalabas sa ihi natin ang protein. So, renal tubular proteinuria may be related here to the damage in your renal tubules because of exposure to your toxic chemicals, heavy metal poisoning, you have severe viral infections, or even Fanconi syndrome. Okay, Fanconi syndrome here characterized by generalized tubular defects. Generalized tubular defects here, the reabsorption. Pag sinabing generalized tubular defect, hindi niya kaya ma-reabsorb lahat ng substances. So, including your protein, including your glucose, including your other mga, even your ions, hindi niya kaya i-reabsorb. Making that one as your generalized tubular defects. That's your Fanconi syndrome. And therefore, pati protein mo, hindi niya maibabalik sa ating peripheral circulation, and therefore lalabas sa ihi natin. And that's, you consider that one as your tubular proteinuria. Okay, how would you know if the problem here glomerular or tubular proteinuria? Pag glomerular proteinuria, medyo madami ang protein na in-excrete niya, more than 4 grams per day. Compared naman sa tubular proteinuria na medyo konti lang kanyang protein excretion. Okay, another one related to your renal proteinuria, we have your orthostatic or your postural proteinuria. So, this is the type of proteinuria that's being experienced when you are having a very long-standing position. Like mga sales lady. In a day, tayo ka ng tayo, sobrang naka-heels pa siya, and eventually try to increase the pressure in your renal vein, and therefore, medyo na-damage ang ating filtration capacity of your glomerulus, and therefore it would allow here your protein na mag-pass through in our glomerulus. And you call that one as your orthostatic or your postural proteinuria. So, to test here, if the patient would have an orthostatic or postural proteinuria, okay, so itong gagawin mo. So, allow the patients to sleep, and early in the morning, collect mo ang urine patient. Pag gising niya, collect ka ng specimen. That specimen represent here the patient nung nakahiga siya. That's in the vertical position. Tama? Vertical. Horizontal position. Then, after that one, magkakollect ka ng first specimen that's right to represent here the patient on the vertical position or the lying position. So, patayuin mo sa patient. Then, after several hours, kukollect mo siya ulit ng sample mo that become your second sample. And that second sample here represent your specimen in the vertical position. Nakatayo na siya. So, pag ang first specimen mo, pag nakalay pa siya, negative ang result mo, tumayo na siya, nag-positive ang result mo, so that's would identify your orthostatic or postural proteinuria na nangyayari lang pag nakatayo ang patient natin. Especially pag sobrang tagal niyang nakatayo. Then we have here the term microalbuminuria. So just testing here the presence of your microalbumin or your albumin that is being excreted in the urine of the patient. So this test will serve here as an indicator for the early renal damage, especially for those diabetic na patient na hindi nakokontrol ang kanilang blood sugar level. And therefore, time will come as a complication of their diabetes na sisira ang kanilang kidney. That's your diabetic nephropathy. And eventually to check here na about to damage ng kanyang kidney or nasisira ng kanyang kidney, then iti-test mo ng microalbuminuria. Pag positive sa microalbuminuria here, mean to say the patient is already starting to have a kidney damage because a consequence of your diabetes, uncontrolled diabetes. So by testing this one, will help here the physician para i-control ang sugar level ni patient saka ang kanyang blood pressure. In order for that na hindi na agad-agad na masisira lalo ang kidney function ni patient. So we have this one, microalbuminuria is diagnosed here if the albumin concentration is 30 to 300 milligram per 24 hour. Or that one is albumin excretion rate of 20 to 200 microgram per minute. Pag itong tinetest natin na method here, microalbuminuria, so 24-hour urine collection ito. Okay, then we have also here your post-renal proteinuria. So, again, the post-renal proteinuria is caused here by the addition of your urine with the other substances that might add up as your urine pass through here in the lower genitourinary tract, including your ureter, pelvis, ureter, bladder, urethra. So it might be added here by the substances that could be found in that area. And this one do not indicate an actual renal damage. So this may be related here to your microbial infections. We have also here your menstrual contamination. We have also here your prostatic secretion, seminal fluid secretion. We have also here your vaginal fluid or secretions, and many others. So that might also be provides also here the additional na protein and might give also here the positive for the proteins. Remember here that you need to really identify if the cause of the proteinuria is renal, pre-renal, renal, or post-renal. So medyo ang pinaka-concern natin if the cause of your proteinuria here is the renal proteinuria. Okay, we have here the test principle here for the test pads for your protein. So that's your protein error of indicator. So basically, this would try to identify only the presence of your albumin. Remember, ang protein natin is made up of your, total protein is made up of your globulin and albumin. Okay, so your reagent test pads would just only identify the presence of the albumin. So, magne-negative siya if your protein is not albumin. So, yun ang pinaka-downfall nitong reagent test pads natin, which is only specific here for the albumin. Why albumin? Because the albumin here will try to accept much of the hydrogen ions because of its amino acid. Madami siyang madami siyang amino acid na nag-accept ng hydrogen ions, making your albumin here as more sensitive for detection of your albumin here for detection of your protein, albumin your sample, that's being impregnated in your test pads. So, yun lang madidetect niya. Hindi siya magdidetect ng other type of protein. Okay, then we have here the indicator used in your reagent test pads na nagko-color change from your yellow to blue to green. So, itong pinakamataas na protein concentration. So, we have your indicator that would eventually try to change the color as it try to have here sense the presence of your increasing concentration of your albumin. So, we have tetramethyl tetrabromophenol, tetrachlorophenol, tetrabromosulfontaline. Okay, so this one, you try to buffer here the entire reaction at pH 3. Okay, so naka-constant ang ating pH. Usually kasi, ang reaction natin, nag-change siya ng color basically because of the changes sa pH. So, dito naman, since naka-fix ang ating pH sa pH 3, so, mag-change ang color ng indicator natin not related to your pH but rather to your protein concentration. Mag-change siya ng color kung pataas ang protein concentration natin. Kaya tinawag siyang protein error of the indicator. It's because it's contrary to the usual na principle na nag-change ang indicator color natin depending on the pH. Kasi dito, nag-change ang color natin not on the pH kasi again, naka-fix ang pH sa pH 3 kaya naka-buffer yan. And nag-change ang color ng indicator natin because of your concentration ng protein natin. Therefore, you call that one as your protein error of your indicator. Okay, reporting here of the result for the protein, we have your trace, a negative trace, 1 plus, 2 plus, 3 plus, 4 plus, depending on, compare mo lang doon sa color chart natin. Anong pinakamalapit na color change. This one could be equivalent to your trace would have your less than 30. Okay, pag more than 30 na, so that's your 1 plus, 100, 300, 2,000 mg per dl. Okay, that for the quantitative reporting. The sensitivity of your agent test pad here for your protein is 30 mg per dl. What do you mean by sensitivity? Magpa-positive lang siya if your albumin concentration in your urine sample should be more than 30 mg per dl. So pag less than 30, hindi niya madidetect. And that will give you a negative test results. Okay, then we have here the interferences with the reaction in your reagent test pad for your protein. Okay, first we have here the false positive result. Okay, false positive result is due to your highly buffered alkaline urine. So another one, you try to carry the reaction in an alkaline pH. Another one, the presence of your quaternary ammonium compounds, antiseptics, detergents also give here the false positive results. False negative, pag may protein ka pero ang protein mo hindi albumin. Okay, the next one, we have here the chemical test here for the protein determination, which is serving here as our confirmatory test for the present protein. So we have your sulfosalicylic acid test, 3%. This is your cold precipitation test kasi hindi tayo mag-heat dito. All you need to do here, equal volume lang ng ating reagent saka ang ating urine sample. 3 ml ng urine sample saka 3 ml ng 3% sulfosalicylic acid. And then try to mix that one and let it stand. Observe here for the turbidity or the cloudiness. So the more turbid it is, the more cloudy it is, the more the protein concentration. So this one, tend to measure here all types of protein, not only specific or limited for your albumin determination. Okay, then we have here the manner of reporting when we are doing your SSA. So, okay, based on the turbidity of your reaction here, so that would eventually try to have the following reporting. So, negative, walang distinct na, walang turbidity. So, trace would have here distinct, noticeable turbidity. 1 plus, you have here distinct turbidity pa, pero wala siyang granulation. 2 plus, on the other hand, would have here the presence of the granulation plus, pero wala siyang flocculation. 3 plus, may granulation, saka may flocculation. And 4 plus, medyo clump na ating proteins. We have here the interference with your SA na test. So we have the false positive result may be attributed to the following. The first one, the presence of your high level of your radiographic conscious media. So you could identify that one by asking the patient if the patient would have here undergoing X-ray radiographic procedures. And also identify here by very high na specific gravity. Another one, the following antibiotics here would also tend to have a false positive result. Tolbutamide, cephalosporin, penicillin, and we have also your sulfonamide. So if you are in doubt, then ask the history of the patient kung nagtitake siya nitong mga antibiotics. And that might be the reason for the false positive result. False negative result here would be the presence of your alkaline na pH na urine. So kanina sa reagent strip natin, pag alkaline na pH, it will give you a false positive result. But here in your SSA, it will give you a false negative result kasi di ba acid ang ating. Okay, so kung alkaline pH natin, ang urine natin, hindi siya mag-precipitate. That will give you a false negative result. Okay, then we have here the newer test method here for detection of your microalbuminuria. This one, make use of the principle of your immunochromatography. Immunochromatography here involves your antigen-antibody reactions. So, tinetest natin sa sample natin ng albumin as your antigen at ang test pad natin may naka-impregnate na anti-albumin antibody as your agent. So, pag ang sample natin may antigen na albumin, since ang test pad mo may antibody na anti-human albumin, so magpo-form sila ng complex, magkakaroon ng color exchange reaction. That's your immunochromatography. So this one, okay siya kasi first morning urine ang ating sample here. Unlike nung kanina, diniscuss natin. With the microalbuminuria, you need to collect on that a 24-hour urine collection. Ito, first morning, it will give you already here a test result. Okay, so the first test, we have your micral test. The micral test is a test pad impregnated here with your gold colloid, gold siya, na anti-human albumin antibody. So if your sample contain your albumin as your antigen, magko-combine siya dito sa ating ito. So magpo-form sila ng complex, akyat dito sa reaction area, meron ka ditong enzyme conjugate. And therefore, magkakaroon dito ng color change. Magiging red ang color niya, mean to say that one is positive. However, here, for example, paano kung negative? Like, pag walang albumin ang ating urine sample, so, kahit may reagent ka na anti-human albumin antibody, since wala kang albumin na antigen, it will not form an immune complex. Pag hindi siya ma-form ng immune complex, hindi siya akyat dito sa ating reaction area, and therefore wala kang color change. And white, going to give here a white na reaction, so walang color change. That's negative. So albumin here could eventually 0 to 10 mg per dl. Another, we have here your immunodip test here. So this is test pad naman. It's being impregnated with your blue colloid anti-human albumin antibody. So blue ang color nito, kaya ang positive reaction natin ay blue na band. So ulit, ganun din ang principle nito. So if your sample contains an albumin as your antigen, magko-combine sa ating colloid anti-human albumin, akyat siya. Magpo-form siya dito ng dalawang band. Okay, blue na band. Okay, then we have here the interpretation of the result of your immunodip. So again, what you have here will be the production of two blue band, one in the bottom area, nasa baba, another one on the upper area. For our interpretation, so the more intense na blue band here, the bottom area, compared with the upper area, okay, that will signify here that what you have is an albumin concentration less than 1.2 mg per dl, and we consider that one as your negative result. On the other hand, if what you have here, dalawa na band here, so, I mean, both your bottom and your upper na blue band would have an equal intensity ng blue color here. That will signify that what you have here, albumin concentration between 1.2 to 1.8 mg per dl, that will signify here a borderline na result. Okay, another one we have here, if you have here much of your intensity of the blue color here, it's on the upper area compared with the lower area, so that will signify an albumin concentration of 1.8 to 2. Others you have here 2 to 8 mg per dl, signifying here that that one is a positive result. On the other hand, we have also here your test strip naman, that would allow you to measure here the concentration of the creatinine and albumin, although unusual ito na mga test strip. So, this would allow you to have a better evaluation of your kidney function, because aside from the albumin, we also try to determine the presence of your creatinine. And those are tests basically for your kidney function. Sample of your test brand here, which has this simultaneous measurement of both your creatinine and your albumin. We have your Clinitech, and we have also your multi-sticks na reagent strip. Okay, we have here the test pad for your, for the albumin in your Clinitech and your multi-sticks. So, ang test principle nito, it make use of your dye binding technique instead of the usual na protein error of the indicator. Okay, so medyo sensitive ito compared with your reagent strip. Ang sensitivity kasi ng reagent strip natin, magpa-positive lang siya if your albumin concentration would be more than 30 mg per dl. Ito naman, ang dye binding technique natin, the sensitivity nito is between 8 to 20 mg per dl na albumin. It will give already here the positive result kung kahit na gano'n na konti ang albumin natin, madidetect niya. Unlike in your reagent strip, kailangan mo muna mag 30 mg per dl to give you a positive results. Again, this is a dye binding technique making use of the dye. The dye na ginagamit dito is your diiodo, dihydroxy, dinitrophenyl, bromosulfonylene. Okay, so that would change the color here. Test positive here would have your blue-green to aqua, pale green to your aqua blue na color that give you a positive results. Interference would be the presence of your blood in a specimen. It will give you a false positive na result. For the test pad for the creatinine, on the other hand, make use of the principle na pseudoperoxidase activity of your creatinine copper complex. Ang reagent natin, copper sulfate, we have your tetramethylbenzidine. Another one, we have your diisopropyl benzene dihydroperoxide. Okay, principle natin, so we are detecting creatinine in your urine sample reacting with your copper sulfate to form here your creatinine copper peroxidase. This creatinine copper peroxidase further try to catabolize your diisopropyl benzene dihydroperoxide plus your chromogen, itong nabibigyan ng color natin, tetramethylbenzidine, that will oxidize this one chromogen para magkakaroon ka ng color change pag positive siya. So positive result here for the presence of your creatinine would be orange, pagiging green to blue, depending on the concentration of your creatinine. So interference would be the presence of your blood in a specimen and even the presence of your drug na similitude. Okay, on the other hand, we have also here some brand of your test pads wherein that could be subjected here to the automation process where they have a separate instrument that would enable here the reading of your test strip here with the automated instrument. So, test strip nilalagay mo dun sa automated instrument. Ang instrument ang magre-read ng result, hindi siya by visual or manual interpretation. So, example for that, we have your Clinitech that would try to present the result of your albumin creatinine and that would allow you also to take the ratio of your albumin and your creatinine in order for that to be more diagnostic with the interpretation of your kidney problem. On the other hand, your multi-sticks by your Pro 11 instrument will also try to report the result here of your creatinine and even your protein, your albumin. So, meron siyang protein high na area. Ang protein high na area niya, na-strip niya at make use of the principle of your protein error of your indicator. Where in the protein low area niya, it try to present your albumin but try to utilize the principle of your dye binding technique. Okay, so we have here the abnormal assay ratio 30 to 300 milligram per gram or 3.4 to 33.9 milligram per mole. So, those are abnormal na assay ratio. So, pag abnormal ang albumin creatinine ratio, it would signify that the patient would have a kidney problem.